Hi, welcome to Master Your Mental Health. Today we're going to have an honest conversation around talking to your doctor about some of your concerns, particularly mental health concerns.
Right. A lot of people wonder how should they approach their doctor. The doctor, actually, the family physician is often the first person that people reach out to when they're struggling with things, in particular like anxiety or depression. So we thought today would be a great opportunity for Dr. Jackie to share some of her expertise and knowledge, and to help us folks who are not doctors understand how to navigate this terrain. So I've got a few questions for Jackie. I get to interview her today. So Dr. Jackie, what is the best way for a patient to bring up to their doctor that they have some concerns? Can you give us some tips?
Sure. Usually I actually ask patients pretty routinely as a matter when I'm doing a physical, or when I feel like I have some time, or I feel like the moment is right. I usually ask people how they're feeling emotionally. But if your doctor hasn't brought it up, it's perfectly okay to say, I'm not feeling well, I'm not okay. Something's happening, or I don't know why, but my mood's not good. I don't feel myself. And your doctor will be able to take that as a cue and to start a process in which we look at a list of symptoms and stratify those symptoms, put them into boxes, not you into a box, but the symptoms, to try and figure out which way to go in terms of treatment and management suggestions. Sometimes if it ends up being quite a long discussion, they might even ask you to come back like the following day just to continue the discussion. Nothing's life and death unless it is life and death. So we don't have to finish everything in one blot. And sometimes if people mention something and I feel like the presentation deserves more time, I'll say, would you please book a longer appointment, and tomorrow it's important to me to have the time set aside to listen to the whole story, to listen to what your concerns are. So usually we ask a bunch of questions about how things are going, what the symptoms are for you. Usually after the first visit, I'll order a set of blood work, because certain medical conditions can present as depression or anxiety. So it's important to rule those things out. And I also like to go into a bit of family history, see if anybody else in the family struggled with some of the symptoms that you're discussing. And one of the things that I do, especially if it's a first visit, I also do a risk assessment for suicide. So I will be, and don't be offended if your doctor says, are you thinking of hurting yourself or somebody else? Because that's one of the standard questions that goes along with treating people with mental illness.
That's a good thing for people to know.
Yeah.
And that was actually going to be one of my questions with you was, what can they expect? And also, is there certain pieces of information that they should be bringing in with them to that first time that they are struggling and they think, I should talk to my doctor about this? What are the things that you need to know in order to do those kind of assessments that you're talking about?
So, for instance, I'm going to use one condition because there's within all of them, but I'm going to use, say, depression, for instance. Then we would talk about sleep, interest in life. Are you feeling guilty that you're not participating more in your world? Energy level, concentration, attention. Are you agitated? Are you really slowed down? And how your sleep's going. So those are the sort of symptoms that we would talk about, but at the same time we would also talk about drugs and alcohol, and any other illnesses that might affect mood, and then, like I said, the blood work. So it's quite an involved conversation. And then again, the suicide risk, that has to be considered as well during that initial visit. And then family history, and then, so this is just say, and then in terms of the depression, I also rule out manic episodes, any episodes of mania in the past, because that changes the management. So sometimes questions might seem like they're not connecting, but in my mind they are. They're connecting, and if the answer to the question will change my management, then I ask the question earlier rather than later. Sometimes don't start medication right away. Sometimes I start on the second visit, the longer visit, so that I can talk about side effects and what to expect. Family physicians can prescribe and do often prescribe psychiatric medication. If it's something that's out of the scope of family medicine, then you would expect a psychiatric consult. So, and that can be done sooner or later depending on how severe the symptoms are. And then there's also resources. I'm going to put a few in the description box, but there are also resources available for people to get help in the community.
And I think this is a really important topic, Jackie. Like I said, that often the family physician is the first point of contact around these issues. And I know that they're often the people that refer to me too, right? They often have people they know that are good in the field. They are a real resource for the patients. So I think,
in fact, that's how we met.
Yeah.
I refer to Alyson.
That's absolutely true. And that's the origins of the idea of our whole
partnership.
Yeah, our partnership, and that mental health is health, and mastering your mental health. But I think that what Dr. and Jackie and I will do is probably do a follow-up to this one too, and maybe talk a little bit more about the management and follow-through and what to expect during your treatment. Yeah. But today's focus was on how to approach
in general
your family physician. So look forward to that one in the future.
And the take-home is, please do mention it.
Please do.
Please do. Yeah. There's no shame. I'll go into, there's a whole novel that I tell people about that, but there's no shame in saying that you're not okay. Yeah. So please do. It's not worth wasting time being unwell.
And what I would say is, in the same way that if you were going into the doctor and you'd been having, an issue,
a rash, a cough,
a cough that isn't going away, that is joint pain that's not going away, and you talk to your doctor about it. Talk to your doctor about
mental health is health.
Mental health is health. So as Jackie always says, we're not giving, this is not medical advice or psychiatric or therapeutic advice. It's us having a conversation, an honest conversation about what we think are some pretty important topics around mental health and health. So thank you for checking in with us today. We look forward to talking about this more.
See you next time, and I'll link the next one above.
Sounds great.
Bye.
Thanks. Bye.